Dr. Ranga, Dr. Manju, can you please come on screen? We can start the event, ma'am. Dr. Meenakshi, yeah.
Yes, we'll begin, Krishna.
Yes, please start.
So good evening and welcome to this afternoon session on a very important subject on ergonomics. Sitting straight matters. This has been told to all of us since childhood, even as early as our school days, and through our parents also. We have been asked to sit straight, but somewhere along the line as we grew up, we really have forgotten this very important element. So we will have today's session on sitting straight. And before I request our CMO, Dr. Manju, to introduce this afternoon speaker, I would like to make two important announcements. One is the chat box has been disabled. So kindly key in your queries at the end of the session in the question and answer box. And secondly, we also have had a feedback form that will be sent to you. It will hardly take a minute. So after the event is over, we request all of you to kindly evaluate and give in your feedback. So thank you, and over to Dr. Manju.
Good evening, all. On behalf of the Hindu group, it gives me immense pleasure to welcome Dr. Venkatraman Swaminathan, Dr. Senior Consultant Orthopedic Surgeon in Apollo Hospitals, Chennai. In spite of his busy schedule, he has given his valuable time for us. And thank you again, sir. Dr. Venkatraman, he carries experience of 24 years in the field of orthopedics, and he specialized in spine surgery and joint replacement. He has a special interest in cerebral palsy, and he had a brilliant academic record and was a topper in MS Orthopedics, Mumbai University. Today, he is going to talk to us about the maintaining our posture when we are working, especially during this period. Most of us are working from home, and related musculoskeletal problems related to that. Over to you, sir. Thank you.
Thank you very much, Dr. Manju, for those kind words of introduction. So today's topic is on ergonomics, and without much further ado, I'm going to share my screen now. And yes, hope you're able to see the screen.
Yes.
Yeah. Yes, sir.
Right. So we'll start off with ergonomics, which is what really is ergonomics. It's basically the science of fitting the job to the worker. And it refers also to the work environment designed to maximize safety and increase productivity. And of course, this dates back to like the industrial era, and of course still is very valid in all these production industries or manufacturing industries where they use heavy equipment and things like that, and very high incidence of worker injuries, so on and so forth. What many people forget is that sitting in front of a desk, staring at a screen for hours together, can also actually be quite injurious to the worker. And therefore, the word is now applicable even to people who have a desk job, which previously some might have thought is not a very arduous task, but is proving quite the contrary. So when you look at this image, you kind of understand what I'm really talking about. If you're going to adopt this image for hours together, 9 hours a day, or even longer, 12 hours, 16 hours a day, 6 days a week, 7 days a week, I mean, you're going to end up in a lot of problems. That's quite obvious. So, researchers have identified that, if you keep staring at a screen, you're likely to end up with some pain in your shoulder, your neck, your wrist, your low back, and so on and so forth. So somebody then asked a question, is it really a method of evolution that we are undergoing? Are we really evolving? Maybe mentally, physically, there seems to be some kind of question mark on that. So what seems to be the ideal position? And there has been a lot of research in this, and people have identified certain postures which are really beneficial. And with the era of using a lot of these desktops and laptops, certain principles have become identified as useful. So the first thing being is where your screen is. So here they've suggested the top of the screen should be at eye level, but there is some recent evidence to say that this may be a little higher, so that your neck is not looking down, but maybe looking just straight. You should not have a light staring straight into your screen, or onto the eyes. It can be behind or it can be somewhere else, or best is to keep it is a little dimmed. And basically your forearms should be lined up with your keyboard, and your elbow should be resting on some kind of armrest. And you got to make sure that your thigh is at about 90 degrees. I would even say that it should be in an acute angle, not even a 90 degrees. When I say acute angle, what I mean is that your knee can be a little higher and as if you are sliding back into the chair, so you're well supported. Your lower back gets an automatic support. Then the extent of the thigh support that you see here, it looks as if it may be a little short actually. I would extend a proper thigh support. So thigh should be well supported. If you're a tall person, if you're sitting in a small chair, it's likely the thigh is not supported. If you're a short person, maybe it's all right. But if you're a short person, the problem you could face is that your foot is not touching the floor there, and that could be a problem. So if you're a short person and your foot is not touching the floor, it's best if you keep a small stool out here so that your foot is then resting on the stool. If you keep your leg hanging down, then it's very likely that all the stress will land up in your thigh and your lower back, and you could experience pain in your lower back. So as far as the lower back is concerned, yeah, you got to make sure that there is a kind of curvature to the lower back where there is a support in the chair. If that is not there in your chair, you can use an extra small pillow to support it so that your back is well supported. So you can also use a wrist pad to support your hands when now typing. And so this is more or less the kind of picture. But there is some evidence to say that this also may not be very ideal. And so what people are saying is that it's best if you keep changing your posture. So maybe from sitting at the edge of the chair, going to the back of the chair, maybe even standing up. So nowadays you have models of tables which that's hydraulic or an electrically operated table, wherein you can raise the height of the chair as per your position, as per the way you want it. Maybe one day you just want to stand a little bit, maybe one day you want to sit. So that kind of keeps the various parts of your body to be adopting various postures, and automatically it kind of does not allow pressure to build up in a particular area of your spine or in your back or in your lower legs or somewhere. So this is another model of how a single table may be adjustable for various workers, but at the same time, even a single worker can keep changing the posture. The way you hold the mouse, if you're especially using a lot of graphic art and things like that, and where you need to really use a lot of mouse work, is critical. It's best if you have a properly seated mouse. And nowadays you have the kind of mouse is vertical, so where you kind of hold it vertically, and that seems to be more ergonomic than the ones where you have to hold it down, as in the older method. So, but it is a kind of trial and error, and you got to see which really works for you. Definitely the one which moves like this is no doubt a little bit more ergonomic in its way. And you got to make sure that your wrist is at a straight angle and it is not acutely bent in any direction. So here is something that I found on the internet. I'm sorry about the quality of the images, but this is something about computer and desk stretches. So whatever posture that you sit at, I mean, however long it might be, eventually you will have to do some kind of stretching and things like that. So various stretching exercises are there in this kind of picture. You can adopt all of them. They're all pretty good. Now, it might take a little time for you to, learn all these things in a proper way. Once you're a master of it, it probably will just take you about a few minutes, 3 to 4 minutes at the most, and then you're back. So you can again go back to working for longer hours. This is something which I found to be useful. It's called the intrinsic muscle stretch. So if you look at the hand, it has muscles which, when you flex your fingers like this, so you're actually, causing muscles to move from your forearm, and then that's how your fingers are flexing like that. But there are some muscles in the hand here as well, and to stretch that, what you'll have to do is you'll have to first, for example, if you just curl up your little finger like this all the way down to the bottom. Once you come to the bottom, what you do is at the last joint you bend it backwards. So the finger has basically 3 joints. So there's 1, 2 and 3. So you curl it up all the way, and then at the bottom what you do is you hold it like that and push it back. So you can do the same, all your fingers. You can try it, and you will find there is some deep muscle in your hand which suddenly undergoes a stretch, which till today you probably never thought existed. So there are some muscles in the hand deep inside which you can stretch. If you do like this, it may not really work as well as when you do it like this. So this is called the intrinsic muscle stretch. It's pretty useful. You can feel, especially if you're working the mouse for long hours and you're gripping something, and at the end of the day your hand feels very tired. This is a very important stretch. It really works, gives you a great deep sense of relief in your hand. So now not everything is about your sitting posture and sitting working. So I mean, yes, there is a lot of equipment and there's a lot of things. If you have not already done it, considering that going forward, it's likely that work from home, people say that it may be some part of your life, may not all part, but some part at least, you may need to work 2 days a week at home or 2 days a week at office or something like that. This is what I hear. So it's best that you invest in a kind of a proper furniture at home. I know till date most people would just look at a normal dining table or chair or wherever and just get on with it. I get a lot of patients every day with the same problem, that they've been using a laptop. I think the laptop is a great invention, but it's horrible. Ergonomically speaking, it's the worst thing ever. The reason being is that the screen and the keyboard are attached together and you can't detach it. So it's best if you detach it, so you can keep the screen at a different level and you can keep the keyboard at a different level, and therefore your fingers don't have to follow the screen as such. And this is one big problem I've noticed, that many of my patients come with the excessive use of laptop, and they come with pain in their hand and wrist. So investing in a proper system at home and investing in some furniture is really useful. The furniture I've outlined, these things are available here itself. In most cities in India and in Chennai, definitely it's available, where you can hydraulically adjust it and posture wise. And so now that you're at home, it's likely that you would have to do other kinds of chores, and therefore lifting things, moving things may become commonplace for you. And it is important to understand that you got to learn how to lift things correctly, because if you do it in the wrong way, I mean, you could hurt your back, and that will then affect your work, how you contribute to your work, because you're going to have back pain, and then you will not be able to sit for hours together in front of a screen. So the way to lift is not to curl your back like that, but to bend your knees and keeping your back straight and lifting it up, as shown in various images here. So here is a kind of a biomechanical study which was done many years ago, and it basically shows the kind of pressure that can develop inside what we call the intervertebral disc. So the intervertebral disc, I don't know whether you've heard of this word. You might have heard of word like disc bulge, disc prolapse, extruded disc, slip disc, or herniated disc. So what is a disc actually? So basically the spine is made of blocks of bone, laid one on top of each other, and then in between the two bones there is a cushion that's called the intervertebral disc. So if you so people have done this study using placing some kind of sensor within it, and then they've tested what is the kind of pressure that you can get. So the kind of pressure is worst when you bend down your spine and you kind of lift a 20-pound weight at about 20 inches away from your chest, and develop severely very high stress in the intervertebral disc. And that can, so what is a disc actually? It's kind of a jelly-like substance. It's like a hydraulic shock absorber, and obviously like any mechanical thing, if you kind of stress it too much, it's going to pop out this way or that way. So so here is now the important thing to understand here. See, when you're standing, it's about 80, but if you're sitting, it's 220, which is higher than lifting a 20-pound weight 10 inches from your back. So if you're sitting for long hours, you're going to cause a lot of stress into the lower lumbar spine. I've had patients. I remember once I had a patient. He was I think a film editor, and he sat for like 36 hours continuously, looking at the screen and doing what he has to do. He had a deadline, and straight away he came to me in the emergency in a stretcher, and we had to do emergency surgery for him because the entire disc had come out and was pressing on his spinal cord and nerves, and we had to do a surgery. And luckily, yeah, he did very well. He recovered completely, 100%. He was going back to job very soon. But this is an unfortunate thing. So you got to understand that if you sit for long hours, you can cause a lot of damage to your tissues inside. So this is an important thing to keep in mind. The other things are obviously these kind of, can lift as a heavy, if you have very heavy use it as a team. Turn with your legs and not your spine. Do use your legs, don't bend your back. Use some equipment whenever you think it's necessary. So these are some things, because the reason why I'm telling this, because I've had patients coming during this pandemic time. They talk about this, they did something and then they start getting pain. Okay. So some of you who are going to gym may understand this picture. The way to lift is called the deadlift. But this is also like a very common knowledge among traditional, like what we call as masons, or Kottanaru in Tamil. But they how do not get back, and they're lifting a lot of weight. I think it's genetic, maybe they've been doing at a young age. But let me tell you, it's actually a trick. It's actually a trick. It's the way you do it. These kind of in the port of, I believe in the coach, there are some heavy all these things, and they have a technique, and the way they do that is that they keep the back absolutely straight, and then they use the thigh to do that. So that's how it works. I'm sorry about that. So I'm just checking my internet connection, right? So yeah, so if you keep your back straight and then keep your knees and thighs a little bit bent like that, you can lift a reasonable. So it needs a little bit of learning. So there's no harm in learning this. It's a very simple thing, but it's a lifelong thing. You can protect your back. Even when you have to, move something or lift something, there's nobody around and you really have to do it. So this is the way to do it. So, but it's best if you practice it a little bit. It's really useful. Okay, so going forward, I feel that a lot of patients that I see actually end up with back pain, primarily because, there is some issue with the strength of their muscles. Of course, posture and work-related issues are there, but there also seems to be something else going on, because had that not been the case, I mean, every human being who's sitting for 20 hours or 10 hours a day should be arriving with back pain. I mean, period. If you think everything is due to a mechanical cause, I mean, there are hundreds and millions of people working in front of a desk right now. All million of people should be ending up in the hospital with back, but that's not the case. There are only some people who come up. So which means something else is the reason also here. Despite having a good chair and good table, you can still get back pain. You can still get all kinds of aches and pains. So what is the reason for that? The reason for that can actually be, okay, in yesteryear's terms, we used to say, you got a weak back or something like that. But today we can break it down and we know what really is weak and how to really go about it. So low back pain and core strength. So core strength is something around the, this part of your abdomen. So this is the lower part of it. So if you do this exercise, so just hold this position for about 1 minute daily. So, hold your body like a plank on your elbows and on your toes. Excellent exercise to build up your strength. This is something which many people do not do. It's called the side plank. And in my opinion, this is I would rate this exercise much higher than the previous one, because it works out the sides here. And just to give you an example, I had this patient. She was a 26-year-old girl. She worked in the IT industry, and she came to me one day. She came with a very, very stiff back, and her spine was absolutely stiff. And she came and she said, "Doc, I've been having this severe spasm and stiff pain for a month now. I've tried all kinds of treatment, but it's not working. I'm just not able to bend." I said, "Okay, let me just see. Why don't you just bend and show me a little bit?" She tried, but she just couldn't bend even a little bit. The back was going into spasm like that. So of course, by the time she met me, she had met a lot of orthopedic doctors, spine doctors, even physiotherapists, and she even did an MRI scan of her spine, and the MRI was totally normal. There was nothing in the MRI, absolutely pristine. The intervertebral disc, everything was good. It's a mystery. Why is she having this pain? So, when I get such patients, I always ask them to lie down on the couch and I say, okay, do this side plank, just let me see how good is your core strength. Let me see that. So, and I told her to do that. And she said, "Oh, doctor, I know this exercise. I've been doing it now for 2 years." Okay, there goes my trump card. I thought I just can't do anything now. So, but then she said, "Doc, I've been doing only on the right side. The left side, I'm not doing at all, So why do you do that?" So, no, because the right side was a little easy, left side was a little difficult to begin with. I just didn't do it at all. So here was a girl, 26-year-old, with an absolutely normal spine, MRI proven, and she was doing an exercise which strengthened one part of her back and the other part was absolutely weak. To begin with, it was weak and it weakened over time. So there was complete imbalance between one side and the other side, And this, the brain was perceiving it as some kind of injury or something. and it went into a rigid spasm. So I told her that you got to get up on this couch here and you have to do the side plank exercise. I don't care. And I forced her on the couch and she was game for it. She tried to lift. She just trembled like a leaf. She was just there for a fraction of a second. That's all. That's all she could hold. The other side she could do pretty well, but this side. And then I said, okay, now get up and see how you feel. And straight off, she could bend 90 degrees. Straight away she could bend 90. Here is a clue that, not everything is related to some disc or something, mechanically wrong with your back, nothing like that. Most of the time in my experience, it's actually a muscle imbalance. And this muscle imbalance actually happens as you grow older. Younger people have a lesser chance of having as you grow older, you tend to find one side is weaker than the other side. Anybody more than 30 can try this right now. And you will always notice that one side is a little weaker. If it is weaker, you're programmed to get back pain in a short while. So it's best that you strengthen it and prevent back pain actually from appearing in any posture that you take actually. Here's another great exercise to strengthen your back. So lie down like this and lift your trunk. You can start, if it's too difficult for you, you can start with one leg at a time, one hand at a time, and then eventually land up here. This is also a great exercise called the bird dog exercise. So you use alternate hand and leg exercise. This is something that I always use for people who come with significant back pain and who have gone into some people end up with back pain and the spine is gone off into one direction. So if you do this, it's just a balance exercise, not a strength. It's a balance exercise. So you got to really balance yourself. Your core has to really balance and it has to fire some muscles. So it's usually a brain connection. It's not like the muscle is technically, if you cut open the muscle and you examine it under a microscope, you're not going to find anything. It's all going to be perfect, pakka. But it's coming from your brain. The connection from your brain has weakened for some reason. So you just have to learn your brain to fire it a little bit, and then it restarts again, And then once you get the balance, the pain just disappears. Here are more exercises which this is called the dead bug exercise, and this is the reverse. This is all some yoga exercise also. Okay, so moving on to upper back pain and neck pain. So if you look at these muscles, I've always wondered. So whenever I do cervical spine surgery, I open it up and I see that really spindly muscles, thin straps of muscles here. These are the spine. These are the neck muscles actually. These neck muscles are absolutely hopeless. And I always think how is it that these kind of muscles really hold up this head, which is one of the heaviest part of your human body and still manageable. So, but there's one big muscle which is it's called the trapezius. It's a shoulder muscle. Okay, the muscle doesn't know it's called a shoulder muscle, but we as humans have named it as a shoulder muscle, and so therefore it's supposed to move the shoulder, not your neck. But if you look at its attachment, it's actually attached to the shoulder and also to the neck, right up to the occipital bone, right along to your upper back. So this is a huge muscle. This is the muscle which is actually holding your head. This is the most important exercise. So I've had patients. I had this Bangladeshi patient, 60 years old, and he said he had neck pain for about something like 30 years. And he said, "Doc, you got to do something. I'm suffering." I said, "Okay, I've got an exercise planned for you, and you have to do this." Oh my God. His son was 30 years old. He said he fell off his chair. I said, "Doc, you sure? Like, he's 60 years old. You want him to do dumbbells?" "I'm absolutely sure. This is what he has to do. He has to do dumbbell exercise. He has to strengthen the trapezius." Okay, so but the man was game because he said, "I've had pain for 30 years. Nothing has worked for me. I'm ready to try this." And he went and tried it. He came and met me after 6 months. "At least 50% of my pain is better, doctor. Thank you very much." And he was quite fine. I've had so many patients like this. I've had recently another patient who had 7-year neck pain, was suffering. He tried n number of therapies and physiotherapy and orthopedic surgeons, and nothing could be done about it. And everybody just gave up. And I put them on this exercise. His pain disappeared completely. I also had this patient who was a high society lady, and she had this neck pain. I put her on this exercise. She was completely all right. The pain disappeared completely. And then it so happened that she went to New York. She met some doctor there, and then the doctor said, "Oh my God, why are you doing this? You're going to enjoy yourself. Don't do this. Drop it immediately." And then she stopped. A year after that, she came back to me and she said, "Doc, I'm having this severe pain." I asked, "What happened to your exercise which I taught you?" "Oh no, this is what happened. I went to New York. Some doctor said to stop it." And then, oh my God, this is too bad. It was a huge task, to restart those exercises for us. So this is something that people don't understand. When you exercise, you have on a maintained level. And then once you drop exercises, it's not like, when you drop exercise, the next week your pain is going to start. No. It may start after 3 months, it may start after 6 months, it may start after a year. And you would fail to make the connection between stopping that exercise and the onset of the pain, because the time lag is so much for the muscle to weaken significantly for you to understand that this is the so strengthening exercise is critical, very important. The same thing you can do, so forward lift and uplifts. So these are absolutely mandatory. So when you strengthen your shoulders, actually you're strengthening your neck. So people with neck pain can straight off do this. I've yet to come across a patient who said that, this has not helped me. I've had, senior doctors also coming to me. I've had my own colleagues from Mumbai who call me and he said, even without seeing any X-ray MRI, I just said, you start this, the pain just disappears completely. Anybody with neck pain, I would always recommend you start with this. And of course, the weights that are shown here are very heavy. You don't have to really lift any heavy weight. You just have to need 1 kilo or 2 kilo, very, very lightweight, something which you can lift off very easily. That's all you need to do. Just need to do about 10, 20 counts each, and that's it. There's another common condition known as, frozen shoulder. So people come with frozen shoulder, which is like a pain in the shoulder. It's more common in diabetics, but it's common in other people also. It can happen anytime after the age of 30, 35. Frozen shoulder by itself is a self-limiting condition. It goes away after 2 years by itself. The word, people who don't understand it, but the word frozen by itself means that the shoulder gets frozen, and you just can't lift it up like that. I know, strange, you just can't move it. So basically what happens is that the ball and socket joint is good, but the capsule around it is completely frozen. And the reason for that, nobody really knows. But I have found this one single exercise, just this one exercise alone, really helps frozen shoulder to a great deal, to a large extent. Anybody with this kind of pain here, which comes down here, so you got to do this stretch across your chest and you'll find an immediate relief in pain. The other thing that is seen is tennis elbow, and so tennis elbow is pain on the outer side of the elbow here. So all you got to do is stretch your elbow like this. You got to stretch it. The more you stretch it, tennis elbow pain usually disappears, along with strengthening exercise with mild dumbbells. So the thing that I'm seeing very commonly is people with heel pain or knee pain. People, especially in this pandemic times. So this pandemic times is given a different kind of situation. The situation is that you're always at home. You wake up, you hit the desk, and you go back to sleep. That's it. Day on day, week on week, month on month, you're doing this. Now, in yesteryears, what was happening is that you would wake up, you would dress yourself, and then you would get out. You would have to walk somewhere. You would have to maybe take a bus, ride a car, go on a drive, and then eventually you go to an office. You have to walk a few meters, 100 meter, 200 meter, go up and down the stairs, break for lunch, you walk. So, this kind of movement, actually, what it does is that it does something known as dynamic flexibility. So that is, as you keep moving, certain muscle groups, they get some stretch and they stretch themselves and they realign themselves. This is particularly so as soon as you cross 30, all these things happen. Less than 30, your body, you're very young, your tissues are very soft, nothing really happens. But as you cross 30, these things start creeping up, And so I've been getting a lot of patients who come with this kind of aches and pains, especially heel pain. So the number one cause for heel pain, plantar fasciitis, is tight calf muscles. This is the number one cause. You will not find it on internet. Google will not give you this answer, because Google is useless when it comes to medical advice. Let me tell you, unless you're a doctor and you know exactly what you're searching for, Google will always give you the wrong answer, because Google is a funny thing. It'll pick up only, so it's basically depending on how much noise is there. There's more noise, bad noise is more, it'll show up bad noise. The good noise more, it'll show up. What I mean by that is that if somebody has a bad experience, the human nature is to generally tell all and sundry about it. If somebody has a good experience, especially when it comes to medical treatment, nobody talks about it. Because as in Tamil, there's a kannu patrum, or nazar lag jayega, that kind of stuff. So nobody wants to share it. I've had a good feeling. I've undergone this surgery. I did very well. I don't want to tell anybody about it. But the reason being is that in Indian culture, it's like that. The more you talk about it, something bad will happen. So nobody talks about it. But let's say the other way around. If you have had a bad experience, that's it. You will announce it like All India Radio, and everybody will come to know about it. So, but Google just picks up that. It just picks up who makes more noise. So that's what it picks up. So when it comes to medical advice on Google, worst. Unless you know exactly what your specific word, what you're looking for and all that stuff, that's different. But if you don't know, just searching like that. So when you look at number one cause of is tight calf muscles. Calf muscles. So this is an exercise that I have designed, and it really works fantastically in most people, at least in 90% of people. So you got to, so if you sit in this posture and just reach out and catch your foot, 90% of people will not be able. Generally, people are very stiff. What I would recommend is bend your knee and then catch your foot, and then slowly straighten the knee to 180 degrees and close the gap, and you will find your thigh and your calf, and I can guarantee you your heel pain will just disappear the next day. It will be gone. This is another way to stretch your calf muscle. If on this leg, not that leg. So in this leg, stretch your calf muscle in this direction, and you have to hold this position for a period of about 20 to 30 seconds, and you will. This works very well even for knee pain. The same thing happens in the sitting posture. You're sitting constantly. This is your knee. You're sitting and thigh and become tight. They shorten because they don't have the ability to flex. Flexibility is not there, and then over time it gives rise to abnormal biomechanics to your foot and your ankle, and you start getting aches. So both these exercises are just great exercises. Muscles in the bum area. So you got to take your left knee to your left shoulder like that. So yeah, some may identify it as yoga postures. Absolutely fine if you're yoga and you're good at it.
So
Great.
sorry to break in, but we are losing you. We are not able to hear you clearly.
I would all really keep away a lot of musculoskeletal diseases from your life. Any better now?
Yeah, it's better.
Can you
now.
hear me better, or is it better now? Okay,
Yes,
I'm so
sir.
sorry.
Now
I'm
it's
so,
better.
so
Now it's
sorry.
better.
Yeah. So if human body has two parts to it, the biophysical and the biochemical. So the biochemical, everybody knows, it's with medicines and food and all that kind of stuff. Whatever you eat is both biochemical. What about biophysical? Biophysical is related to your gravity and so on and so forth. I'll just highlight that a little bit. And that involves this kind of muscular stretching and things like that. And yoga is a great factor in that. So some more exercise. Bhajarasana is a fantastic exercise for people with knee pain. The more you stretch it, the less your pain will become. And this is your half squat or quarter squat exercises for people with knee pain. Again, just going halfway or quarter way, not all the way. Do 10, 20 times. It strengthens your thigh muscles and your core muscles. You really do well with these exercises. So I'm just going to skip a little bit. So osteoporosis, what is many people come and ask me and tell me this also. Doc, I'm having this knee pain. I think I have osteoporosis. Doc, I'm having this back pain. I think I have osteoporosis. So let's understand what is osteoporosis. Basically, weak bones. Your bone become weak. So this is your healthy bone. That's your weak bone, and the reason for it lies in calcium metabolism to some extent. So you need vitamin D, parathyroid hormone, calcium, testosterone, estradiol. So estradiol is a woman's hormone and testosterone is the male hormone, and both of them play an important part in the strength of the bone. So let's look at vitamin D. We've heard a lot of chatter about vitamin D recently. It's useful for n number of things, including COVID. So let's have a look at what's going on here. So basically, vitamin D is produced from two bad things. I mean, generally people consider it bad. One is cholesterol, people consider it bad, and ultraviolet rays, people consider it bad. But when these two things combine, you can produce vitamin D in your body. So therefore, vitamin D is actually a product of two bad things, and it is found in the liver and the kidney, and you end up with the active form of what does vitamin D do? It basically helps in absorption of calcium from your gut. So if you have very low vitamin D, you can eat ton of calcium, but it will not get absorbed. So you got to have adequate vitamin D. Then only so vitamin D doesn't have any natural source of nothing in the food. You can't get it from your food. You can only get it from ultraviolet rays and exposure to sunlight. And that sunlight has to be strong sunlight. It has to be from 10 a.m. to 3 p.m. It's not like, early morning and early night, late night and all, late evening and all that. Doesn't work. You need the ultraviolet rays. In fact, if you get early morning, you get basically infrared. That's not good enough. You need ultraviolet rays. Ultraviolet rays is a strong sun. They've done study in that. They had volunteers, stand behind this kind of glass, which has an ultraviolet blocking screen on that. And they found that the vitamin D production actually decreases. So that's how they found ultraviolet rays the one which you needed. So vitamin D is critical to strengthen your bones and your calcium. So what happens if your bone doesn't have calcium? Bone doesn't have calcium. This is what you can do to your bone. It's like just a piece of rubber. So calcium for your bone. And so osteoporosis, many people consider as a cause of pain. Actually, it's not. Osteoporosis is never a cause of pain. Osteoporosis is a silent disease. So people call it the silent disease. Silent disease means what? You have this problem, but you never knew it was there. And one day, you have a problem due to that. And what is the problem? It's not pain. You get a fracture. You just break your bone. Like you fall down. You have a standing fall. You're standing. You fall like this and you fracture yourself. You fracture your arm. You fracture your wrist. Fracture your hip. You fracture your spine. You're not supposed to fracture. You're not supposed to fracture if you're just falling like that. You're not supposed to fracture anything. But if you fracture, you have osteoporosis. So it's a silent. You never knew all along. Suddenly one day you fell down and you broke it. So this is osteoporosis. If you're in construction industry, you will know, like if you're many years later, your ceiling will suddenly, some part of it will fall. That's osteoporosis actually, because it's become weak and it just dropped. So of course there are various reasons for that happening, but I'm just trying to give an analogy of what it is. So similar in osteoporosis, as you age, it becomes weak and then you fall down and you break it, So here's a graph which tells you what really happens to bone density. So what I showed in the first slide, which showed the density of two bone, normal bone and osteoporotic bone. What happens with the age? So normally when you're young, your bone density is not strong, but between the age of 25 to 40, your bone is really strong and you have an ability. So, and what happens after 40 is that everybody is on a downslide. So it's all sloping down. Some people have a steeper slope, some people have a lesser slope, but eventually it's all sloping down. And at a particular point in time, the bone becomes so weak that you can break it. 1 in 3 women can end up with this, what we call as during menopause, their bones can weaken excessively rapidly than a normal course. And this happens because women are protected from a lot of diseases because of the hormone estrogen. But at menopause, suddenly this umbrella of estrogen has disappeared and suddenly exposed to a lot of things. And 1 in 3 women, not everybody, 1 in 3 women end up, and it's mainly the reason is that a genetic predisposition, so it runs in the family. If there's a family history, it's likely that you will have it. And the bone suddenly becomes weaker and you can end up with a fracture. But there is a really one group of people in this whole world who never get this problem of osteoporosis. That is, bone loss or bone weakening, or, not really significant. And can you guess? It's actually kind of people who are weightlifters or bodybuilders. Weightlifters, people who lift a lot of weight, get very strong bones. So the bone is a funny kind of tissue. The more you stress it, the stronger it becomes. The less you stress it, the weaker it becomes. So if you don't stress it, if you take bed rest for 1 year, you just lie down like that, your bone will weaken. Because the body thinks, okay, the purpose of the skeleton is to be strong and, okay, you're just lying down, not doing anything. Okay, let's remove all the, and it just becomes weak. And over time, it just becomes weak like that. So the way to strengthen it, so people who lift a lot of weights, bodybuilders and weightlifters, they never get this problem. The reason being is that this graph actually goes up very high for them. So the bone density is so strong that even if they have this curve, it's still very strong. They never end up with any kind of fracture. So now the funny part is that at any age, you can lift this graph up. So you can do it even at the age of 50 or 60. If you start lifting some mild weights, 1 kilo, 2 kilo, your bone strength will increase over time. So the graph which is going like that will go up and then will start going down. So it kind of slows down. So, and this is very important to understand. So the same thing can happen in the corollary, which is people who are going to space. There's no exposure to gravity. I mean, there's no gravity out there, zero gravity. And what happens to them? The bone can weaken so fast, so rapidly. If you stay for 3 months in the space and the International Space Station and you come down, very high chance of getting a fracture. As soon as you're exposed to Earth's gravity, you just break it like that. So So this just shows that our body can change as per the gravitational exposure that it undergoes. So if you lift weights, you're exposing gravity going through your bones, and some of the body then fires a lot of signals and strengthens it and makes it stronger. So this is something about bone density, menopause, and also about osteoporosis. So osteoporosis doesn't cause knee pain or back pain. You can only end up with a fracture. I'll come to why you get knee pain and back pain. So here are some examples of this. Is what I was telling you about when I was saying, like, the spine is made of bricks of bone laid one on top of each other, and in between lies the intervertebral disc. So of course this lady had a trivial fall, and she, the spine just crumbled like that. And you can see that normally the spine is like, it's got a squarish shape, but here it's trapezoidal, which means that it's crushed. So it's called a fracture. It's called a compression fracture. So we do something known as we inject something known as bone cement, which is actually fast-setting acrylic. It sets in 10 minutes. It goes in a liquid form, and once you have injected it, it fills up that space and makes that area strong. So it does strengthen that area, but it does nothing to the remaining part of the skeleton, for which you need other kinds of medication and exercises to strengthen the remaining part of your skeleton, so that you don't get the same problem few years down the line, because this addresses only at this point. This was another lady. She was about 70, I think 60. She came with severe anemia, very weak, and she had multiple fractures. She was in bedridden for nearly 2 months, and she couldn't get up and move. A high-risk patient, but we did something known as minimally invasive surgery. So just through small incisions, we put screws and fixed it. She was up and about in a few days. So some more examples: you can get fracture in your wrist, and which can be fixed. You can get fracture in your shoulder, which also can be stabilized. So that's how we treat those kind of issues. So what about this pain in the knee and the back and the neck? What happens there? So there's something known as osteoarthritis. So this is slightly different. It's a degenerative condition, can affect the neck, the lower back, the hips, the ends of the fingers. So strange enough, it can affect this joint, at the end of the finger here. So many people think osteoarthritis is a kind of wear and tear, a degenerative condition. Okay, doc, how do you explain this? At the end of your finger, why are you getting this, wear and tear? Because there's no really that much action going on out here, but you get wear and tear. So therefore, what I'm trying to say is that not everything is mechanically based. There are some other deeper reasons why some people get knee pain, some people get back pain, and we'll just run through what are the cause. First cause, of course, is age. As you grow older, you can get it. Second cause, the most important cause, in my opinion, is family. Family means what? Does it run in your family? Other people with knee pain, somebody has undergone a knee replacement, somebody has undergone some spine surgery, somebody has undergone, likely you carry those genes. So it may be your father, it may be uncle, it may be uncle to somebody, it may be anybody. It's a huge tree. The family tree is a big tree, and you get genes and you share genes with so many people. So that's how it works, Of course, if you play very high demand sports when you're young, and if you're excessively overweight, 200 kilos and plus one, so then yes. And gender, female patients, women generally feel more pain for the same degree of degeneration. Nobody knows why. And last but not the least, work. So if you do a lot of manual labor, yes, it's possible. So here's a kind of example. I just wanted to share with you what is knee pain and what is osteoarthritis. So there's a thigh bone and the leg bone, and you see a gap here. Obviously, it's not like you're walking on some vacuum or something and some air. There's something out there which is not seen on the X-ray, because the X-ray is just a shadow of the bone. So there is a kind of cushion out there, not seen on the X-ray. And when the cushion thins out, then the gap reduces. So when we say the gap reduces, what we mean is that, this is what we say. Many people get confused. Some people say the gap has increased. Doc, I've got this X-ray, this gap has increased. Gap doesn't increase. The gap only decreases. So here the gap is lost. And that means that the cushion is worn out and the knee is worn out, and if the knee is damaged, and that's what it means, joint space narrowing, and so on and so forth. So this can be a natural course of progression. So it takes many, many years for this to really progress very badly. So in early stages, you can give some medicines and exercises, injections are there. And of course, in last stages, you do, sometimes you can do a keyhole surgery. Sometimes we do what is called as an axis correction surgery. So we change the angle of the knee, and that actually helps. And you can save your own knee, and the same knee can be used for many more years, at least 10, 15 years, even beyond this. So Of course, when the knee comes in such a bad situation where it is, the leg is going out, and then you have to do what we call the knee replacement. So this was a lady, she was about 70. She could barely walk. I mean, like, even going to a toilet was an arduous task for her. So, and this was after about 2 months at home, and she could walk very well. And so the knee replacement is one of the most successful surgeries in orthopedic surgery, and a person can have great relief in pain. This was about 7 years ago, and this will last for at least 20 years. So some more examples of, so here's the lady who was walking with a severe waddle like that, and but the waddle somehow sometimes it doesn't disappear. It may reduce, but it doesn't go away, because the brain has kind of connected like that now. She was quite fine. She was very happy. The pain had disappeared. And this was a lady who I told her not to do it, but she said, "I can do it, doc." And she sat on the floor. Yes, you can do it. If you're young, you're strong, and you can do this. It's not a problem. Once in a while you can do it. Maybe not every day, not all the time. You cannot do it then, because it's like you buy a car or a two-wheeler and the maximum speed shows 200 km/h. If you drive every day at 200 km all the time, you're going to damage the engine, right? So same thing here. If you do this, you can do it once in a while. No problem. Nothing will happen. Yeah. Thank you very much for your kind hearing. I'll end my talk here and I'll stop sharing. I'm ready to take questions on any topic that people think is important.
Yes, sir, that was a wonderful presentation, and there are already a few questions lined up, sir, for you. The first one is from Ms. Fatima Mary. She says her query is, at almost 60 years, can one do planks?
Absolutely. I have my 87-year-old father-in-law. He lives in Calcutta. He's got leukemia. He's got hypertension. He's got heart disease. He's got 3 stents in his. And whenever I go there, I recently went there also. He has to do the plank, the side plank, the stretches. And of course, typically, they stop doing it and then they find difficulty in walking. I start doing that and then it's up and about again. Absolutely, you can do. There is nothing like you cannot do at any age or anything, unless you're constantly breathless or something. That's a totally different thing. But if you have had some kind of medical problems and it's all under control, you can start even 5 seconds if you hold. Great job. 5, 10. I'm not saying long, just 5 seconds. Start. You got to start the side, especially the side plank. You find back pain all just disappearing so quickly, and it's absolutely safe. Nothing will happen to you.
Fine. Okay. Thank you, sir. The second question is from Anand Malage. He's written, "I recently have undergone MRI scan. Below is the result, but please advise." And the result shows L4 to 5 and L5 to S1 levels, diffuse annular bulge with posterior central small size disc prolapse. Causing compression over the cordia equina, bilateral, neural, foraminal narrowing, lateral recessor. I cannot understand that.
Okay,
sir.
I understand what you're saying. No problem. I understand very much what you're saying. This is a big trouble. Okay. So MRI, unfortunately, you can tell me the report, but I need to see the film.
Yes.
Because there is unfortunately in MRI, what happens as a radiologist, there is some medical things that they have to mention. They see something, they say it is impinging on something, it is effacing the, so on. So these are not English words, mind you. Please do not, this is not a translation to English. These are medical words. They mean something which only I as a doctor will know, but you as a lay person will never know that. Number one. Number two is that eventually I need to see those images. Then only I can really understand, is it of any significance or not. But based on what you're saying, I can tell you straight away, it's probably insignificant. The most important point is that, is the person having back pain or leg pain? If there is leg pain, then whatever the report is saying has some significance. But if it is just back pain and there is no leg pain, then it just means that the back is weak and you just need to do again those strengthening exercises. I have to say this, at the age of 40, they did a study. Let's say you take normal people without back pain, no back pain, never had back pain. If you take at the age of 40 and you do 100 MRI scans, 40% of them will show disc bulge, disc protrusion, disc effacement pressing, the impingement of the nerve, so on and so whatever you said just now. 40% of people will show it on the MRI, but they never had back pain ever. So therefore, whenever somebody transfers an MRI report, it doesn't make that much sense to a doctor, especially an orthopedic surgeon or a spine surgeon. You have to see the patient and understand what is the pain. But based on what you're saying, I can tell you, it doesn't look alarming to me. It looks like just a regular back pain. All you need to do is some stretching exercises, some planks, side planks, strengthening exercises. So here I can just tell you, this is the past president of the American Academy of Orthopedic Surgeons. When he was retiring from the presidency, he said that I've always followed these 4 things which have kept me very, very healthy. And these are the 4 kinds of exercises. One is cardiovascular exercises. That is like walking, running, cycling, swimming. So it pumps your heart and your lungs. It's good in good condition. Second is strength exercises. So you got to make sure that your body is strong. So you got to lift some weights. You got to do some planks. You got to do some squats and things like that. You don't have to really work out like some crazy fellow, but just a little bit you got to keep doing. Third thing is flexibility. So you got to do a little bit of stretching exercise, some yoga, some stretching exercise. And the fourth thing that he mentioned was balance exercises. So something like Tai Chi, which is a Chinese exercise program, but you can always learn it. Nowadays there's YouTube. I mean, knowledge is there for everybody to just, take it off. So, learn some balance. So if these 4 things, if you do, you can rid of almost any ache and pain in your body. I'm sorry. Yeah, you can please proceed.
Yeah, thank you, sir. There are 2 questions from 2 anonymous attendees. The first one is, my upper arm hurts very badly for the past 1 month. No doctor has been able to help. Please advise. No associated problems. Back is fine, so are the shoulders. But there's a complaint of upper arm hurting.
Yeah, so this is very inadequate information, but I can say 2 things. The first question is, does the arm pain reduce if you keep your hand on top of your head? So if it reduces, this means that the pain is coming from your cervical spine. Okay, but if you feel the pain is increased or it doesn't change when you do this, that means the pain is from your shoulder joint. Okay, so if it is from your cervical spine, you'll have to do dumbbell weights. If it is from the shoulder joint, you will have to do stretch across your chest. If none of these, and if it's a left-sided pain, you have to get a cardiology opinion. That's the first thing. If it's a right-sided pain, you can just ignore it. And so that's the way I would suggest that the person who is asking this question can do it themselves. The stretch across your chest is a treatment for shoulder pain, and lifting weights, the treatment for neck pain. You can try it yourself. That's not a problem. Okay. But definitely the information is very less. But based on this, I would suggest that, they can self-treat, no problem. If still is not responding, I mean, yeah, you would have to meet an orthopedic doctor and, take a consultation proper.
Thank you, sir. The next anonymous question is, I need knee replacement. I'm 50 years old. And for how long can I postpone the surgery?
Yeah, so some time back, 60 was the age limit, you got to do knee replacement after 60. But this is not like some kind of, crazy Lakshman Rekha or something like that, 59. It's not like that really, You got to understand how much the knee is troubling you and stopping your life from going forward. So I got to tell you this. So generally, the modern knee runs for about 25, 30. This is the latest data which is coming. 25, 30 years it runs, no problem. 80% of people have still a functioning knee even at the end of 25 years. So if you undergo at the age of 50 till 75, at least you're running. At 75, you can undergo a revision knee, and that now has a guarantee for running for at least 15 years and 95% success rate in that also. So you're looking at maximum age of 75, one more surgery, and you can go on to 90 without any problem. Yeah, I mean, that's a pretty long life in my opinion. And, so if your pain is really bothering you at the age of, and I've done also for people who are 45, 48, because I know when I look at the X-ray and the knee pain and the patient that I see, they're really suffering. They just can't do anything about it. Their life has come to a stop, a standstill, It's absolutely so. There's nothing like a Lakshman Rekha, like, at the age of 60, I got to do it. Before that, I should not do it. Nothing like that. Absolutely nothing. In fact, the earlier you address this knee problem, you prevent bigger problems settling, because of your knee pain, you can't walk, you can't do things, you can't do exercises, and then eventually you end up with other issues. If you develop diabetes, blood pressure, you're supposed to walk, you can't. You're firing other parts of your body also in that sense. The second thing that can happen, many people start taking painkillers, and on the sly, I just can't bear it, I'm taking it once a week, twice a week, thrice a week, something that just steps up, and they end up with renal failure. When I visit my dialysis ward in the hospital and I ask my nephrologist, 50% of people are on painkillers or have been on painkillers, knee pain, back pain, neck pain. 50% of people. So, that's a big eye opener. I mean, you got to understand. That's why in India, we get this, what we call as non-steroidal anti-inflammatory drugs, which is diclofenac and all this, aceclofenac and brufen and all that. And people abuse it. So in the West, they said, don't do that. And then they give something else. They get they get this codeine for, which is actually a narcotic analgesic, and the people get addicted to that drug, because the same problem exists. Everybody gets knee pain, back pain. It's not like Indians get it and foreigners don't get it. Everybody gets it. So that they take all this codeine and they get addicted to that drug, and that now today is a big problem there, because people have addicted to the drug. It's a mental addiction. They really can't get off the drug, but the pain goes away, but doesn't have any kidney side effect and all that stuff. So my suggestion is that if you're in the early stages of the disease, definitely focus on stretching, strengthening, and all those kind of things. You can really push it out. There are studies which say even yoga really helps, delaying any kind of surgical treatment. But if you're at a stage where your knee is gone and you really is damaged, your back is damaged, and you really are suffering, it's best to undergo surgery, because today the promise of the modern technology is so good that you can lead an absolutely painless life, and you can really do normal things what normal other people do.
Yeah, thank you, sir. The other question is, what type of posture tips are required for employees who are working in a press, especially in the standing posture?
So working in a standing posture, what kind of posture? So yeah, that's a great question. So if you're standing at a particular spot, and this applies not only to employees who are standing, but even to housewives, people who are working at home, because they sometimes cook a lot, they stand for 2-3 hours in the kitchen, and because again, there you're just standing on, so, and they start getting pain on one leg or the other leg, something like that. So if you have a small stool or a step, you can keep one foot on that stool for some time, then alternate it with the other stool. So what happens is that the stress is transferred, and you don't get excessive stress on one leg. You can transfer it. So what really happens is that when you're standing constantly, there are biomechanical changes happening, and the intracompartmental pressures increase over time, and they start getting painful. But if you offload it, even for a short while, the pressures start dissipating, and then you are able to again come back to stressing it again. So that's what I'm saying. There's a biophysical reason why you start getting pain. So keeping a small step or a stool and keeping your foot on top of it, and relaxing, so it relaxes your back, relaxes your knee, and you can keep shifting like that, half an hour on this leg, half an hour on that leg. Absolutely useful. The third thing is using something known as a bar stool. So if you go to this, this bars where you get alcohol, they have a high stool, So, basically you're at a very high level. Only your bum is sitting on the stool, but you're completely offloaded. Your legs are completely offloaded. So even that also really helps. You may be standing behind a desk. The desk is high, but if you keep a high bar stool, the person is almost standing, but is not actually standing, is actually sitting. So then you can easily shift in and out of that, changing your posture, as I said, So that really helps, in decompressing that pain.
Yes, yes, sir. That was from Jayaraman, and this next question is from Mr. Ramakrishna. He says, this is Ramakrishna from Vizag. I met with a major car accident in 2015 and fractured my neck of my femur, left femur. Underwent a major surgery with the titanium screw and rod inserted. I still have the implant inside. I still do brisk walking and also jogging. How are strong? What is this? How strong are my bones? Do I need to get my bone density tested?
Yeah, so firstly, you've had a major vehicular accident, which is a high velocity injury. That doesn't mean your bone is weak and that's why you broke it. the bone, everybody's bone has some strength limit. I mean, it breaks beyond a point. So I don't consider this as to be a case of osteoporosis. But your valid question is that after the accident, maybe you're not that active, but you said you're running and jogging, which is great actually. You just have to do more of it. As far as checking your bone strength, the two things come in is, one is whether you, how old are you? If you're more than 65, you may consider doing a DEXA scan. And also you got to look at your family history. Is there somebody in your family, like your father, your grandfather, somebody, your aunt, your uncle, somebody who just fell down and broke their hip, broke their shoulder, broke their wrist? Then there would be an indication that you may be having osteoporosis. If that is so, then you'll have to do a DEXA scan and some blood tests. You'll have to meet a local orthopedic doctor and evaluate and understand whether you need any medication or not. 90% of the time, male patients do not need medication. You just need to do some exercises, especially spinal strengthening exercise, which is like you lie down on your stomach. And I said, lift your hands and lift your legs. There are studies which say that if you just do this simple exercise, your spine bone becomes as strong as if you're taking a drug for it to strengthen your bone. There are new drugs which have come. It's a daily injection for 2 years, teriparatide, and they have found that exercise is as good as taking the drug. So the bone strengthens that much. So spinal strengthening exercise is absolutely great. So I would suggest these things for you.
Yeah. Thank you, sir. There's one more question on, even I had this doubt. What are the inputs while driving 2- and 4-wheelers? Because many of them say if you've been driving 2-wheelers since a very young age, you may, tend to have all these spinal difficulties. Is that true, sir?
See, I don't think there's any merit to that, okay? The reason why I'm saying that again, like I said, if that were really true, nobody would be driving a 2-wheeler. And 2-wheeler industry will just close. The fact that so many people are riding it, one or two few people get some problems. And of course, if you're going to drive you're going to have some ache or something, that's fine. But if you look deeper into such issues, usually such people have a genetic problem. And if you take an MRI of their spine or something, you'll find that the disc is collapsed, there's some degeneration and stuff like that. That's why they get the pain actually. So if you have a degenerated disc and then you do a 2-wheeler driving, you're going to have pain. Then you cannot do the 2-wheeler driving. You have to drop it. But does the 2-wheeler driving cause this? I don't think so. This would have happened even otherwise. And even after you not driven your 2-wheeler, you would have still got it. But with an issue like having a degenerated disc in your back and you're driving 2-wheeler, you're likely to aggravate it. So therefore, I would say 2-wheeler doesn't cause that. But if you have back pain, you're not able to drive a 2-wheeler, yeah, I would still recommend, stretching, strengthening, and things like that. But the best thing there would be to, reduce your 2-wheeler activity and use public transport if it's possible, or move to a 4-wheeler or something like that. Yeah.
Thanks, sir, for making it clear. There are some more queries raised by Mr. Anand Malage, who had written about his MRI.
Yeah.
But I think we can skip that because I think you've made it very clear that you would like to see or examine the patient before.
That's right. Yeah. That's all I can suggest.
And there's one more person who's written, anonymous. I have been having year-long pain in the rhomboid major round the clock. Rhomboid
year-long pain. Okay. Right. Yeah. Yeah. So well, again, the rhomboid major people is there. Okay. This pain is typically from the neck, actually. Many people don't make the diagnosis, but I know what it is. It's actually coming from the cervical facet joint. The C5-6 and C6-7 have a innervation supply going down to the rhomboid major, and it's actually a referred pain from the neck. So such patients, I would recommend again strengthening exercise. If you haven't done it, dumbbells. If you got the pain by doing the dumbbell, which is also a small possibility, then you would have to, a doctor has to see you and examine you and understand what's the reason for your pain. But if it's not due to dumbbells and you've been having sedentary lifestyle till now and you've developed this rhomboid major pain, all you got to do is dumbbell exercises, your pain will disappear. The other thing that I forgot to add is, the way you sleep at night, posture at night, how you sleep, use a pillow, not a pillow, that kind of stuff. So my suggestion is to always use a pillow, a firm pillow of medium height. Try and avoid this memory foam and all that kind of extremely soft pillows. They're absolutely useless. They don't support your head at all. So you need something which supports your head a little bit. So firm pillow. Take a rolled towel, a Turkish towel or something, and keep it under your neck. So therefore, you got this what we call a cervical contour pillow. So you get it on the online also. It's contour. So the contour fits in your neck here, and then, I mean, that's also great. But you know, the trouble with that is this one size doesn't fit everybody's shape and size. You know, so you got to find it out for yourself. You can use a pillow, but you may have to use some additional towel or something to adjust the height. So most important thing is that when you're sleeping, your head mustn't tilt off to one side. You know, it should be aligned with the remaining part of your body. As long as you follow that simple principle, and it's a trial and error. You got to understand which is the best posture for you, best pillow for you, and then you can stick with it. And you know, your neck pain, generally the early morning pain which you get neck pain early morning as soon as you wake up. It's a pillow problem. The problem is in the pillow, and you got to readjust that. That's all.
Thank you, sir. There are just a few more questions. You'll be able to take it, sir?
Yeah, sure, no problem.
There's one from Mr. Samandam, BS Samandam. He's thank you for this excellent presentation. And he's asked, is there any suggestion for a posture while sitting in a car and while driving?
Yeah, so sitting in a confident posture it's something, again, you got to find the best posture for yourself. You can use one of those small pillows, or you know, one of those lumbar arch support in your car. If your car seat doesn't already have it, then you can support it. That also helps. But you know, coming back to it, I would really recommend, you know, do some stretching, do some strengthening, and I can assure you, you can adopt any posture. You won't have any pain whatsoever. So I would really suggest, you know, you focus on some exercises. Not everything can be addressed by, you know, just by readjusting. Maybe temporarily it'll be okay. Maybe for, you know, a couple of years you'll be fine with the small pillow on the back. But then after 2 years, again your pain will start again somehow, you know. So address the core issue, which is core strength, stretching, strengthening. Do that regularly. You can drive a 4-wheeler, you can drive a 2-wheeler. You should not have a problem.
So, there's one person who's written it anonymously. Can I get a knee replacement surgery done during COVID times? Is it safe? I'm vaccinated.
Yeah, absolutely safe. No problem. We have done so many right now.
Okay.
Not an issue. So you'll have to have your RT-PCR test done before the surgery. If you're vaccinated, that's great. Absolutely safe to do it. Not a problem. We've not had any problems there.
Fine.
But and don't do it when there's a peak. Okay. I mean, do it when there's a lull, like, you know. Yeah.
There's one query from Ms. Varsha Budurani. Her query is, I've recently suffered a depressed comminuted fracture involving the lateral tibial plateau. The bony depression was approximately 9 millimeters. I underwent surgery 5 months back, and 3 screws were fixed to repair this fracture. I'm undergoing physiotherapy. Although my knee is much better, my ankle hurts and swells up, which is stopping me from being able to put full bearing of my weight on my legs and to get back to normalcy. What can I do to rectify this, and for how long will it take for things to get back to normal?
Yeah, so you've undergone the surgery, which is right, absolutely, that needed surgery, and you underwent that. So the thing about it is that some ankle swelling may be there. It will be there for about 6 months. Then eventually it will go away. I won't really bother about that swelling, especially if in the morning, if you wake up with no swelling, and as the day progresses, you get swelling. That's something you can just ignore it. You try to be as active and focus on strengthening exercise, which your therapist might have told you. Just focus on that. And it should be, but on an average, 6-9 months, you will have some swelling. Just ignore it. Nothing to worry about.
Yeah. The person who asked the first question, sir, Dr. Fatima, she's inquired whether we could share your PPT with all the participants.
Yeah, I'll do that. What I'll do is I'll share with my marketing executive, and she will then share it with whoever is in charge here. Okay. And we'll have all these exercises, and you know, specific exercises. I'll share it.
Thank you, sir.
So thank you, Dr. Venkatraman. It was a very good session, you know, a lot of inside information on correction of posture. I mean, the way you carry a weight, and then how to build the core muscles, etc. And it was a very, very useful session. Thanks for your time, and also patiently answering all the questions from the participants. Yeah. Thank you so much.
I'd also like to thank all the participants for linking in. And it was really wonderful, sir, because from head to toe, you have, you know, as Dr. Ranga explained, you have, you know, answered all our queries. Thank you.
Most welcome. Pleasure.
And thank you, Apollo Hospitals, for sponsoring or arranging this program with Dr. Venkatraman. Thank you so much. And Srija, as usual, you've been very supportive. Thanks a lot.
Yeah, thank you, Doctor.
Yeah.